The U.S. Department of Health and Human Services. The U.S. Department of Health and Human Services is one of the 15 federal bureaucracies that makes up the cabinet departments. Essentially, a bureaucracy is an organizational system that is based on hierarchical authority, job specialization, and formalized rules. Purpose. Its motto is improving the health, human services, and well-being of America. The main goal of this department is to protect the health of all American citizens and provide essential human services. They also sustain research in medicine, public health regulations, and social services. The United States Public Health Service is the main sector of administration of this department, led by Alex Azar. The United States Public Service Commission Corps is the uniform service of the PHS that's led by the Surgeon General of the United States. A majority of the major appropriation bills of Congress that affects the Department of Health and Human Services have been passed at the time of the government shutdown of early 2019, which means they didn't suffer any major deficits at the time. However, one big component of this department was the Food and Drug Administration, or the FDA. It receives a large amount of funds for its food and drug safety operations through the spending bill of the Department of Agriculture that was completely tangled up in the shutdown. Consequently, a portion of the advancements for food and drug research were halted, but the immediate needs of patients, medical staff, and facilities were still readily available to citizens, as well as their workers still being employed.